Quality of population. The quality of population depends upon the literacy rate, health of a person, indicated by life expectancy and skill formation acquired by the people of the country. The quality of population ultimately decides the growth rate of the country. Illiterate and unhealthy population are a liability for the economy. Literate and healthy population are an asset for a nation. So, we should give more and more stress on quality of population. Education. Education contributes towards the growth of the society. The national income and cultural richness is enhanced by education. It also increases the efficiency of governance. The literacy rate have increased from 18% in 1951 to 74% in 2010-11. Literacy among male is nearly 16.6% higher than females, and it is about 16.1% higher in urban areas as compared to rural areas. It means more people are educated in urban areas, more people are educated in men's as compared to women. Literacy rate varies from state to state also. For example, it is 94% in Kerala to 62% in Bihar. This is the graph which shows the literacy rate in India. In this graph, we can see the number of males, females who are literate in India from 1951 to 2011. It is constantly increasing. Sarva Shiksha Abhiyan is a significant step towards providing elementary basic education to all children in the age group of 6 to 14 years. It is a time-bound initiative of the central government in partnership with the state and the local government. These policies could add to the literacy of the population of India. The 11th plan endeavored to increase the enrollment in higher education of the 18 to 23 years of age group by 15% in 2011-12 to 21% in the 12th plan. The plan also focuses on distant education coverages of formal, non-formal, distant and IT educational institutions. Over the past 50 years, there has been a significant growth in the number of universities and institutions of higher learning in specified areas. Health of a person helps him to realize his potential and ability to fight illness. If he is healthy, he will be able to do the work. Improvement in the health status of the population has been the priority of the country because only the healthy people can work more efficiently. Our national policy too aims at improving the accessibility of healthcare, family welfare, and nutritional services with a special focus on underprivileged segment of population because they are the people who are undernourished. So, it is rightly said, health is wealth. Without health, nothing is there in the world. Over the last 5 decades, India has built up a vast health infrastructure and has developed manpower required at primary, secondary, and tertiary sector in government as well as in private sector. These measures adopted have increased the life expectancy to over 66 years in 2011. Infant mortality rate has come down. Crude birth rate have dropped to 22.1 and death rate to 7 within the same duration of time. Increase in life expectancy and improvement in childcare are useful in assessing the future progress of the country. Reduction in infant mortality involves the protection of children from infection, increasing nutrition along with mother and child care. Unemployment. What is unemployment? Unemployment is said to exist when people who are willing to work at the going wages cannot find jobs. The workforce population includes people from 15 to 59 years. In case of India, we have unemployment in rural as well as urban areas. In case of rural areas, there is seasonal and disguised unemployment. Urban areas have mostly educated unemployment. Now, what is seasonal unemployment? Seasonal unemployment happens when people are not able to find job during some month of year. In case of disguised unemployment, people appear to be employed. They have agricultural plot where they find work. This usually happens among family members engaged in agricultural activities. The work requires the services of 5 people but engages 8 people. These 3 people are called disguised unemployed. Now, in urban areas, mostly educated unemployment is maximum. Educated unemployment means the people are educated but they are not finding work according to their qualification. There is unemployment among technically qualified person on one hand, while there is a dearth of technical skills required for economic growth. Unemployment leads to wastage of manpower. People who are an asset for the economy turns into a liability. Unemployment tends to increase economic overload. The quality of life of an individual as well as the society is adversely affected. Increase in unemployment is an indicator of depressed economy. In case of India, statistically, the unemployment rate is low. They appear to work throughout the year, but in terms of their potential and income, it is not adequate for them. They may therefore want other work of their choice. But poor people cannot afford to sit idle. They tend to engage in any activity irrespective of its earning potential. The employment structure is characterized by self-employment in primary sector. There is disguised unemployment in agricultural sector. Now, let us discuss about the employment scenario in the 3 sectors mentioned earlier, that is, the primary, secondary, and tertiary sector. Agriculture is most labor-absorbing sector of the economy. In recent years, there has been a decline in dependence of population on agriculture, partly because of disguised unemployment discussed earlier. In the secondary sector, small-scale manufacturing is the most labor-absorbing. In case of tertiary sector, various new services are now appearing like biotechnology, information technology, and so on. So, the government should try to make people aware and also take some initiative to provide employment to the people so that unemployment problem can be sorted out and unemployment can be reduced from the Indian economy, and the people can be the assets for our own economy and our country. See the farm laborers working and they are employed in primary sector.